All right, so this is more of Joyce Kaufman giving an anecdotal tale to tell us what healthcare is really about. Let's listen.
Healthcare in Puerto Rico is a lot closer to what we're about to see healthcare in America look like. When you go to the hospital, you got to bring your own sheets, your own pillow. You got to bring your own cup and your own pitcher for your water. My mother was hospitalized in the final days of her life in Puerto Rico.
This is pretty embarrassing.
Was particularly upset by the conditions of the hospital, but that's just the way it is. When there's no money to pay for things and you're a senior citizen, you're the first one that gets compromised. So every now and then my papa comes here and he...
So let's get this straight. Puerto Rico has what, 40% of the median GDP, median income in the United States? Let me look that up. And let's see, we're a $15 trillion economy and you're comparing us to Puerto Rico? Okay.
Well, let me tell you how the Medicare system has devolved and how much worse it's going to get when $500 billion get cut from it, which is what you have in your Affordable Health Care Act that Congresswoman Debbie Wasserman-Schultz and former Speaker Nancy Pelosi keep...
That's right. We're going to cut the waste, the redundant services. There's not corruption and waste in Medicare. Come on, wake up. Hundreds of billions in waste and redundant care in Medicare, and overcharging for various fees and for various tests, etc.
To accept Medicare, doctors that Papa used to see no longer accept him as a patient. Some of them simply leave practices. And it's only going to get worse. And now it's not going to affect just seniors, but it's going to affect everybody. And trust me, when you don't have great doctors, you don't have great medical care. When you have doctors in their 50s and 60s opting for early retirement rather than having to hire new staff to get through the paperwork that's going to be required, all of this paperwork that's going to be burdened to these practices, they just say, not interested. Not going to do it. You didn't do anything.
You know, when conservatives complain about paperwork, that's remarkable for me because when you talk about paperwork, there's no greater entity as far as overhead costs and paperwork than the private insurance market. Medicare for All would solve that. By the way, Puerto Rico's median family income, $16,000. The United States median family income, $50,000. Let's stop comparing the United States with Puerto Rico. Puerto Rico is way behind in economic development and in wealth. It's a stupid comparison.
I'm not hopeful.
Of course you're not hopeful.
When I see Papa told that he cannot see the doctor for 2 months because there's such a shortage of physicians who will see the Medicare patients, I can see what's ahead for me. You see, right now, because I pay for an insurance policy,
so ridiculous.
And I'm willing to pay for a deductible, a rather large deductible. When I call the doctor and I say I need an appointment, I get an appointment. Because my doctor knows that between me paying cash, the first $1,500 out of my pocket every year.
Oh, brother, so ridiculous.
A good portion of my medical care, and me sending a payment every time I receive a bill that says, well, your insurance only paid this much, you owe $500, and I cut a check.
Okay, I gotta stop this crazy woman here. The idea that the United States is going to have a doctor shortage. First of all, the United States is a sponge for imports, for immigrants. People would love to come here. Our doctors are paid twice as much, 3 times as much as the average doctor in Europe, and higher than doctors in other parts of the world. We could easily allow more doctors to come into this country. Reform immigration laws. Let's allow more doctors. That'll lower the cost of health care. $1,000 in premium savings a year if we were to have a free market in doctors and allow doctors to come into this country. Just a little fact check there. No, the doctor shortage is imposed because the AMA, a powerful lobby, prohibits skilled workers, doctors, from coming into this country. Let's continue with the rantings here.
Unless it was a checkup appointment. No, I'm not sick. I just want to chat. What? I mean, it's foolishness. And it's going to get so grotesque. It really is. insurance companies are going to refuse to be insurance companies anymore.
That's right.
They can do other things. You know, they're investment banks now, insurance companies.
They always are. They always, I mean, insurance is very close to banking, by the way. Have you ever heard of the reinsurance market? They act like banks already. That's not changing. What's changing is, insurance companies are not going to be like historical insurance companies in that they're not going to have to screen for something known as adverse selection, because now anybody with a pre-existing condition is allowed in. But the way that you counteract that and them getting flooded with a lot of sick people is by having the individual mandate. That's what they did in Massachusetts under Romney, a Republican, and you don't call him a totalitarian threat.
I was growing up in my childhood in Washington Heights, where these charlatans would perform abortions on kitchen tables.
Oh, brother.
I didn't want to see that anymore, and I thought we should have a safe and a legal way for a person who was raped or molested by their father to terminate that.
Okay, enough of our rape fantasies. Anyways, the thing is this. You know, it's just so hilarious. Wow, there's so much to say here. The healthcare system in this country, you know, we're now going to move into the next phase. The next phase is absolutely cost containment, by the way. And we're going to have to make some choices about getting rid of the waste and the redundancy in the system, and the fact that we have a lack of competition in the system. Here the conservatives make a good point. One of the ways to get rid of the lack of competition in doctors is by having a free trade policy with doctors, or not a free trade, but a free market policy, rather, with doctors, and allow doctors to come in here freely. Let's listen some more.
Or my husband, if he's beating me, and never have to even question whether or not there was a legitimate reason to do it.
What does this have to do with health care? Praise hell.
Privacy, isn't it? It's between me and my doctor, or me and my husband, or me and you.
It's just ridiculous.
The next term, we already have a case on affirmative action in higher education. We have a case on voting rights. We have same-sex marriage. All of this is coming up in the next session.
Okay, I guess she's getting off of healthcare. Yeah, I'll stop for now. You know, these Republican right-wingers are just fucking full of shit. Like I said in my previous video, where were they when the Republican Party was for the individual mandate? It was when Obama touched it that they became opposed to it. Maybe in my next video, when these right-wing conservacunts bring up all these 21 supposed taxes that are affecting the middle class, which they aren't. That's a lie. That's BS. They're just trying to scare people. That's all they're about. They're about scaring people, extorting you for more money, and then stabbing you in the back, and taking away your programs and giving them to the bankers and the rich. Remember, the Republicans were for the bank bailout, but when we had a bailout for homeowners or the people who are really suffering in this economy, that's communist, that's socialist. Can't have a bailout of our healthcare system either if it helps the people, because we can't let the people have the idea that the government can work for them. No, they're supposed to stick for themselves, and meanwhile the rich get welfare and the rich feed off the government trough.